This is the video on dermatomes. Part of the organization of the nervous system has to do with the target locations of sensory nerves. Each dorsal root ganglion and its relative spinal nerve innervate a specific region of skin on the body. These regions are dermatomes. The spinal nerves are responsible for transmitting all sensory information from these skin regions, such as temperature, pressure, or pain, to the CNS for processing. There are 5 different regions of dermatomes, based on the paired spinal nerves stemming from the spinal cord. Though there are 31 spinal nerves, and 1 dermatome per nerve, there are only 30 dermatomes. This is because C1 typically does not have a sensory root, making the dermatomes start at C2. The cervical dermatomes originate at the neck and cover the head, upper chest, and majority of the arms. They do not, however, cover the face. As the picture shows, C2 and C3 make a balaclava shape around the face, since cranial nerve 5, the trigeminal nerve, is responsible for all the sensory information of the face itself. There are 12 thoracic dermatomes. They cover the entire torso, front and back, and run down the inner arms. T1 covers the armpit, upper chest, and inner arm. T4 is located at the nipple line, and T10 is at the umbilicus. Though the thoracic dermatomes appear to be stacked like discs, the lumbar dermatomes run more vertically, down the fronts of the legs. This is due to spinal nerve formation. Since our nervous systems start development in our early embryonic stages, the nerves have dermatomes that correspond to our natural curled-up states. If we were to bend over, as shown in the picture, the dermatomes would all align vertically. Besides just the legs, lumbar dermatomes stem from the lower back region and are therefore responsible for that sensory information as well. The sacral dermatomes run vertically down the posterior part of the legs. They originate from the base of the spine, and the dermatome regions make a target shape around the tailbone. The final pair of spinal nerves stem from the coccyx. The coccygeal dermatome is located on the area of the skin on top of our tailbones. Since dermatomes are topographically organized according to the locations of spinal nerves, they are incredibly useful for clinical applications. Though each person's dermatome map looks slightly different, the general patterns help medical professionals identify locations of lesions in the spine or other underlying medical problems. For example, if there is a loss of sensation for a certain dermatome, it is probable that there is something wrong with the spinal nerve that innervates that region. When there is tingling or numbness in a certain dermatome, that is characteristic of a pinched nerve, typically in the cervical and lower lumbar region. This symptom of tingling helps doctors determine which nerve root is being compressed and gives them a better idea of how to fix the problem. Other clinical applications are diagnosing shingles, due to rashes covering multiple thoracic dermatomes, or identifying the extent of traumatic injuries based on partial or complete loss of sensation. This ends the video on the dermatomes.